Good morning, everyone. We'd like to start our workshop, and welcome to the National Academy of Medicine's Global Forum on Innovation in Health Professional Education. We're very pleased that you are with us today for this workshop. When we had our forum meeting yesterday, I was able to say that we were in the second most exciting meeting in D.C. today. That was yesterday. Today we're in the most exciting meeting in Washington, D.C. So for the workshop on the social determinants of mental health, we have two workshop co-chairs who will lead us in our proceedings, Kennita Carter and Carl Sheperis, and they will be shepherding us through the agenda. So with that, I will then introduce Carl Sheperis, who will lead us for this morning's session. Carl?
Thank you, Dr. Evans. Greetings, everyone. Good morning. My name is Carl Sheperis, and I am the Dean of the College of Education and Human Development at Texas A&M University in San Antonio. I serve as co-chair for this workshop, and I want to take the opportunity to welcome everyone. I also want to take an opportunity to thank the Planning Committee. Anyone on the Planning Committees in the room, please stand and just be recognized for a minute. Thank you all for your service in putting this together. Thank you. The Planning Committee put together a lot of hard work, and we had a lot of great meetings and great discussions, and it was just an amazing opportunity to work with such a distinguished team. It's a great honor to work with my co-chair, Dr. Kennita Carter, who I will introduce as soon as I get done. I also want to thank Patricia Cuff. She is the director of the Global Forum on Innovation in Health Professional Education. Thank you, Patricia. And Katie Perez, who is the research associate for Health and Medicine Division on the National Academies. I want to thank them for their vision and their leadership in organizing this workshop. I think it's going to be a great day and a half. Thank you both. As an educator, I often start workshops like this one by reviewing the learning outcomes so that participants can take ownership of the process and ensure that you take away what you want from the session. It'll also help provide a framework for your participation. So, what are the social determinants of mental health? We can't really separate the social determinants of mental health from the social determinants of health. So the reason we're engaging in this discussion around the social determinants of mental health is to highlight a specific aspect that hasn't received enough attention. When we talk about mental health, we're really talking about the entire range of mental health and mental wellness, from the elements of mental health that are part of basic human functioning to the various mental health disorders that impact a subset of the population. As we explore the social determinants of mental health, we're going to be tying together systemic issues such as poverty, violence, addiction, and protective factors that mediate the impact of the challenges. We'll also look at how these combine to impact the overall mental health and functioning of patients. So overall, our objective here is to understand the mental health and physical impacts of being exposed to the social determinants from macro and meso levels so the knowledge can be applied in a micro level. And if you'll bear with me, I'm going to go through each of the learning outcomes so you can really see what we're trying to accomplish over the next day and a half. After this workshop, the social determinants, hang on one second, sorry about that. My speaker notes weren't all up here. So after this workshop, participants will be able to understand the impact of the social determinants of mental health across the lifespan, understand how mental health can be incorporated into health professional education framework for the social determinants of health, differentiate the impact of the social determinants on physical and mental health at macro, meso, and micro levels, examine the opportunities to expand health professional education to incorporate the social determinants of mental health, identify experiential learning opportunities related to the social determinants of mental health for health professional education, design a framework for delivering education on the social determinants of mental health to health professionals in training, and to implement strategies for health professional education that incorporate the social determinants of mental health. So as you look at these, I want you to think about what your goal is in attending today and what it is you would like to accomplish through this learning process. So in a sense, we would like you to consider a learning contract where you consider what it is you want to take away and what level of participation you'll have in this process. We're going to go through case studies over the next day and a half and ask you to break into groups and to think about how you'll participate. So as part of that learning contract, what we'd like to do is have you think about, first, what level of participation will you engage in and what will that discussion look like? Second, how will you bring your own personal experiences with health professional education and the social determinants of mental health to the table? And third, what will you do after the conference is over in order to expand your knowledge and to continue being able to integrate social determinants of mental health into health professional education? And with that, I'd like to turn it over to my co-chair, Dr. Kennita Carter, for her introduction and welcome. Thank you.
Good morning. Good morning. Thank you. I'd like to also welcome you to the Global Forum on Educating Health Professionals to Address the Social Determinants of Mental Health workshop. It is an honor and a privilege to co-chair this workshop with Sheperis. I'd also like to thank members of the Planning Committee for the many rich and sometimes challenging discussions around the social determinants of mental health. We had multiple conversations covering a gamut of topics, including what are we talking about when we talk about the social determinants of mental health? Are they the same as the social determinants of physical health? Are they different? If so, how are they different? How do we create a workshop that will engage you, the members, and the guests of the Global Forum, both in the room and online? And I'd like to welcome all of those viewers who are viewing the webcast to draw on the broad range of your expertise, experience, and perspectives, both professionally and personally, to design transformative learning opportunities on a topic that is incredibly important and challenging on multiple levels. Everyone here today has something unique and important to bring to the conversation around the social determinants of health. Over the course of the next day and a half, as we go on this journey of learning more about the social determinants of health, the hope of the Planning Committee is that individually, you will identify pearls of knowledge or key messages and or actions that you can take, as well as collectively contribute to the development of, let's say, a train the trainer, teach the teacher educational module, if you will, of educating future health professionals on policy change as it relates to the social determinants of mental health. To this end, the agenda has been designed to cover the social determinants of mental health using the framework that Carl just talked about at the macro, meso, and micro levels. Of course, macro being the 60,000-foot policy system level impacting actions on the federal level, communities, cities, and states. meso affecting groups of people, and micro impacting individuals. So I'd like to share my personal story about a pivotal moment for me around policy change and the social determinants of mental health and health that incorporates components of the framework. So this took place when I was a teenager in Los Angeles. To provide a little background, my mother was a psychiatrist, and her best friend from medical school became a pediatric cardiologist. His name was Dr. Ernest Howard Smith. He practiced at Martin Luther King Hospital in South Central Los Angeles. He was a part of my extended family, like an uncle to me, a mentor. So back to the story. One day, Dr. Smith comes by our house and asks me if I want to help save the summer youth job program so that other young people might have job opportunities in the summer. My immediate response was yes, but immediately I thought, how on earth could I do something to help make a difference? So of course I asked him, how can I help? And he said I should ask a few of my friends from my neighborhood to help make a few posters to save the summer youth job program. I had my doubts, but I looked up to him. So I went around my neighborhood, got a few friends together, we made posters, and that day we went downtown to Los Angeles City Hall and walked around with our posters. Somehow, the media came and picked up the story. It made the news and contributed to helping to save the federal summer job program, which was at risk of being cut. For me, the lesson was that even though I was a teenager without a degree, not even a high school diploma, that with a small group of friends, it was possible to make a difference. So to use the framework as it may apply to learners. At the macro level is the employment status for young people, a social determinant of health. And these are young people in communities where they may not otherwise have opportunities. At the meso level, this impacts a group of young learners, me and my friends. At the micro level, the impact was one very personal and transformative as an individual, learning that I didn't need to have a degree, I didn't need to have a title, that with my passion and my commitment and my willingness to try, that I too could make a difference. And so with that, I would like to thank you and welcome you and and now transition to introduce Dr. Ruth Shim, our first speaker. Dr. Shim is the holder of the Luke and Grace Kim Professorship in Cultural Psychology in the Department of Psychiatry and Behavioral Sciences at the University of California, Davis School of Medicine. She is an associate professor of clinical psychiatry, director of cultural psychiatry, and chair of the Vice Chancellor's Advisory Committee on Faculty Excellence and Diversity at UC Davis Health. I should say that it was just tremendously exciting in our planning sessions, in talking with Ruth on the line. And so I anticipate that you too will be excited and engaged to hear what she has to say about a very important topic. Please join me in welcoming Dr. Shim.